The coronavirus pandemic threatens to derail the global goal of ending AIDS by 2030. In South Africa, home to the largest population of people living with HIV, it has put pressure on an already fragile public healthcare system. In 2016, the United Nations set the 90-90-90 goal for 90% of all people living with HIV to know their status, 90% of all diagnosed should receive anti-retroviral treatment, and 90% on therapy will have viral suppression. Sibongile Tshabalala joins us now to gauge how far we are in achieving those targets and indeed ending AIDS by 2030. Sibongile, thanks very much indeed for your time on the AM report this morning. I think 2 years ago, these goals, perhaps we could have said with more certainty that we would reach them. Given the past few years of us living through the COVID-19 pandemic, how likely do you reckon we still are of reaching those goals?
Hello?
Sibongile, can you hear us?
Yes, I can hear you. Can you repeat the question for me?
How likely do you reckon we are in terms of still reaching that goal of ending AIDS by 2030?
Honestly, I think we are very far from reaching the goal of ending AIDS by 2030, looking of the challenges that we are having in the country. We are still struggling to reach the 90-90 goals. And looking at the state of health now, as we're affected with COVID, we have seen a decline on HIV services where people were no longer tested as they were tested before, and the treatment that people are supposed to get, sometimes we are facing stockouts. The health facilities are not up to standard. We have shortages of nurses, and the stigma and discrimination that people are still facing in the health facilities, and the bad attitude that they are getting from nurses still chases people away from the facilities and from taking treatment. So with all these challenges that we are still facing, we are far from reaching the goal of ending AIDS in 2020.
I mean, everything you've just said, Sibongile, has obviously been made worse by the COVID-19 pandemic.
We don't believe that it's just made by the COVID-19 pandemic. Remember, as Treatment Action Campaign and our partners, we've been calling for government to fix the broken healthcare system from long ago, and since around 2012. The challenges that we are seeing today are not of COVID-19. We had long these challenges, but our government was ignoring the call to fix our broken healthcare system. The COVID-19 pandemic find us with these problems, and it made it worse, and it exposed us more as the country, because we have been ignoring these challenges while we've been having them for a very long time.
I mean, we've got the largest number of people living with HIV here in South Africa, with 7.8 million. How do we fare insofar as our counterparts are concerned in terms of our response and our aim of that 2030 goal?
Honestly, there are a lot of things that we have done, and we have so much breakthroughs as a country. But because of lack of political will, that is why we are still dragging, because the political will, it just go a limited mile. It doesn't go the farthest that it's supposed to go. Hence, today we are unable to reach the goals that we set for ourselves. Remember, we said test and treat, but over 7.8 million that are living with HIV, only 4 million that are on treatment. We are still looking to put another 3 million people, more than 3 million people on treatment. So that means we are not yet there, and we have a long way to go in order for us to reach the goals of 90-90-90 and to end AIDS. By 2030, we want to reach that goal by the look of things, the way things are today, and the challenges that we are facing.
So how do we change that number that you've just told us about? 7.8 million people who are living with HIV, 4 million of those are on ARVs. How do we reach that 3.8 million?
We need now to start treating health as everybody's business, and we need everybody to come on the table. We talk, we have strategies, and we work together, because just talking is very cheap. We need plans and we implement those plans together with government. Remember, as we are talking about COVID now, we are worried as people living with HIV to say the other 3-point-something million of people who are not on treatment, we know for a fact where they are immunocompromised, and it means their health is at risk. If they are infected with COVID, chances of them surviving are very slim. So what we need to do as a country is to put a plan to say how are we going to put everybody who's living with HIV on treatment and sustain them, and also do more testing to those who don't know their status, and making sure that everybody who knows their status, who tested positive, who is on treatment, so that we know that almost 90% or 95% of people living with HIV are on treatment. By that, we know that we'll be able to manage the HIV, and by working together, the only thing that we need is working together and agree to say, how are we going to work together? And when we identify gaps and as activists on the ground, the government needs to come to the table and listen to us, and we come up with possible solutions to say, how do we close those gaps? In that way, I believe that we can be able to end AIDS.
So let's talk solutions now. That 90-90-90 goal set by the United Nations, it's 90% of all people living with HIV knowing their status, of all of those diagnosed receiving anti-retroviral treatment, and of everyone on therapy to have viral suppression. So those goals are one thing, but how much of the gaps in our public health care system means that we are further away from reaching those goals?
When you look at the Richitsa Project report, it shows that in almost all provinces are not meeting even the first goal, which is 90% of people who know their status. The second goal also is difficult, and the third goal is worse. We are doing very bad on that. But for us to be able to reach those goals, we need, as I said earlier, we need to work together. We need to implement the policies that we are putting on the table, and we need to work together, civil society and the government, and also every part of the government, every part of the civil society. We need to come together and work together, because health is not an isolated issue. Health it covers everybody who lives, and every department of the government, and everyone who's living in South Africa. So by doing that, we believe that we can be able to reach the goals, and we can be able to meet the target of ending AIDS, but not by 2030, maybe by 2040, not by 2030, by the look of things.
Sibongile Tshabalala, let me thank you for your time this morning on this World AIDS Day. She is the chairperson of the Treatment Action Campaign.